very frustrating to me to say, like, no, but you're a nurse first. So I think that there are different expectations if a program doesn't uphold or really keep those nursing principles at the forefront of their program or their kind of core values for their students.
Mm-hmm. But I was thinking more of in clinical practice.
Oh, that's interesting. I want to say yes, but I think in reality, I think that nurse practitioners are very frequently thought of as nurses and need hand-holding and are not allowed to practice at the full extent of their license. So I think that the role does have differences in the way that they're viewed, but the way that they're used practically, especially in the Northeast, is that they're not practicing to the full extent of their role, and we're kind of treated as an extension of a nurse and still with the same expectations that we won't have as much clinical judgment or we won't know about whatever it is, and, we're, quote, just a nurse.
Uh-huh. So are you saying that the level of clinical judgment that is expected from RN and NP in the Northeast at least is similar?
I think it's similar. I think that an NP is taught to have, but again, it goes back to experience too, because I think it depends on the individual person. You can have an unexperienced NP with much less clinical judgment than an experienced nurse. Mm-hmm. So I think it just really is dependent, I guess, on both the individual and where they are practicing.
Mm-hmm. And then, but this whole process of going through like health assessment, talking to the patient, and coming to an impression, and is this part of like NPs? Don't they have to do diagnosis and treatment plans?
For NPs?
Yeah.
So yes, definitely. So I think the expectation is probably a little higher for expected clinical judgment, but when a nurse goes in to see a patient or outpatient setting, they're expected to get a background and history as well. They're not expected to make a diagnosis but their treatment plan, they still have one. They have their nursing diagnoses and they have that piece of it. So, but again, I guess the expectation is higher in that regards for an NP just because their role demands more outcome for that.
All right. So when you think of a student that comes to NP program, either a nurse or somebody that has no nursing experience at all, what do you think they need to learn regarding clinical judgment to become NPs?
Well, I think, so this is interesting because I teach both advanced pharmacology and their basic pharmacology course. So when I teach their basic pharmacology course, I'm teaching them about how to safely give the medication, whereas when I'm teaching their advanced pharmacology course, I'm teaching them how to safely prescribe and how to make those clinical judgments from what to start with and what to utilize when. So I think that I think that a lot of the NP education role is about developing clinical judgment because they have the skills as a nurse to care for the patient safely, but they may not know or have the knowledge yet on how to prescribe or treat.
Mm-hmm.
So they're kind of honing those other skills that they have the bedside manner, they have those pieces hopefully as a nurse already, but now they need to use their clinical judgment to evaluate and assess what treatment plan and what options we're going forward with.
Mm-hmm. So what is the content that they need to learn to get to that point?
So I think the content they need to learn is, I guess it's a lot of assessment data. It's a lot of assessment and patient outcome data. So it's a lot of, again, I'm going to pharmacology. When I teach pharm, I reference them all the time back to the professional resources that say where these decisions came from. So being able to evaluate the evidence out there so they can assess new studies and new things that come up after they're done school, and being able to critically assess them. So I think they need to be able to have a sound base of how to evaluate research. I think they need to have the actual clinical piece, just like I'm not even sure what the course name would be, but the assessment, diagnostics, etc.
Mm-hmm. And when you think of a student that starts your program, like from day one to the end of the program, can you describe to me how their clinical judgment progresses?
I think a lot of us do with confidence in themselves. So I think that when they start, they're often unsure, and I hear everything they ask me as a question, whereas towards the end, what they're telling me is more of they're telling me, not asking me, when we talk about different cases or different patients. So I think a good deal is the confidence factor, but I think also they are more comfortable with the increased experience through clinicals. I think the clinicals are really, really, really what set it in stone, because it's not until they get into their clinical settings that they're able to apply the information they have been learning.
Mm-hmm. And how do you see, if I were to present you two students, would you be able to see who is less advanced in their program and who is more advanced?
Definitely. I think that talking about a case, you can definitely see who's more, who's further along or who's ready for independent practice. So with that said, I think it's their clinical judgment skills, I guess, is that they're able to utilize them. They're able to give me a background assessment and talk through what they're considering as they work their way through the patient's past medical history and current symptoms and other factors that come into play, and how they're ruling things out and what they're doing. So I think it's the being able to assess how their judgment is in each area and where they're able to come to their conclusions. You can tell.
Mm-hmm. And is there something that makes you think, oh, this person is really ready for independent practice? What are you?
Yes, I think sometimes I'm very cautious with it, because I think confidence can be a big indicator, but it's also really having a discussion with the student to make sure they're truly ready and it's not a false bravado that's kind of out there. So I think that it's confidence, it's the ability to ask questions and not be afraid to ask questions. It's the ability to know their resources and know what they don't know. So I think it's a number of different things that come into play. But I think you can definitely tell when someone's ready or someone's not ready, I guess, is more what I'm concerned with, to making sure that I kind of capture the ones that aren't ready yet and don't send them out before, to make sure they can be successful.
Mm-hmm. And how do you see that they're not ready?
Again, I think confidence is a big piece of it. I think that they're, along with that, they're also either making incorrect diagnoses or incorrect judgments or assessments that are potentially dangerous. So I think that it's a number of different things, being able to see if they can appropriately diagnose a patient and put a treatment plan together with appropriate follow-up and appropriate measures for monitoring in place.
Mm-hmm. And what would you say makes it appropriate?
Well, based on evidence-based research and based on individual patients' needs. So, making sure that they bring them back in for a follow-up appointment within a right time frame can be either based on what the evidence shows, or if we're not sure they're going to, or confident they're going to follow a treatment plan, we might bring them in earlier. Just kind of being able to talk through those pieces of what they're thinking and why they're thinking.
Mm-hmm. And do you think there's a difference in how students progress through the program if they had previous nursing experience or if they didn't?
At first, yes, because I think they come in with more confidence and they come in with a little more grasp on the field. However, I think that goes away once, or can go away once there is more of clinical education in play. So towards the end of the program, I don't think that matters as much. I think it matters more in the beginning and just getting that novice student to the confidence level or to they're ready to make those judgment calls versus the experience.